Hi everyone, this is Dr. Parsa Mohebi from Los Angeles. I would like to tell you everything you need to know about how to repair a bad hair transplant. So what is a bad hair transplant? A bad hair transplant is when the design is not done right. So when the hairline is not where it should be for a mature adult man or woman. Sometimes they come down too much. They create like a kiddie hairline, like a boy hairline, which is okay for a 16-year-old boy, but it's not for a 50-year-old man. Sometimes the transplanted hair is not looking natural. The hairs are not single. They're not as refined as they should be on the hairline of a natural man. They're like 2s and 3 hairs on the very front. They look pluggy. Sometimes the direction is off. Sometimes the angle, even the curvature of hair is important. So FUE hair transplant allows the surgeon to remove hair from wherever he wants and place them wherever he wants with any angle they want. So basically we can remove hair from a scalp, from beard, from the frontal hairline, the area that they didn't have to have hair, but they put them and now it doesn't look natural. So we can remove those and replant them in the right place, right order, right angulation. So the old methods of hair transplant were like plug surgeries. Like plugs, remove pieces of skin were removed and put them on the bald area. There were islands of hair in the sea of baldness. So hair was there, but it was not natural. And then we moved to a strip procedure. Strip procedure was better because we were cutting the grafts under microscope into natural follicular units, but still there was a big line of scar in the back. The hair was removed through a strip and then suture mark and everything in the back that needed to be improved. Sometimes the methods are not very outdated, but the design is not right. So for example, the hairline. The hairline should be in a certain position at any age, especially for adult Caucasian. When we design a hairline, even if the person is a young person, we should not give them a very low hairline, although the hairline could be very low to start with. So we have to go higher, predicting that this hairline is permanent. It never matures anymore. So wherever we put hair at any age will stay there for the rest of the patient's life. Some of the problems that old hair transplants or bad hair transplant had were like the natural distribution of the hair. We want to have single hair grafts in the very frontal hairline, followed by 2s and 3s on the back. That looks very natural, give you that nice transition in front, and it's going to be denser and fuller on the back. Angle of hair is very important. The curvature of hair is very important. Distribution of hair is huge. So you want to put hair where it's more important, gives more meaning and more significance to patients' volume of hair. So by doing that, the hair from certain areas can cover the other areas too. So this is a gentleman who had a hair transplant, a strip procedure many years ago. In this procedure, you can see that he does have this hairline that is way lower than what is good for his basically race. For a Caucasian man, hairline should not be that low. A better hairline is a little bit higher, at least 2 centimeters higher than what it is. And those frontal hairs, you see some of them are pluggy. If you look very close, you see like 2s and 3s on the very close area. And because the density is not very high, they show themselves. So we designed this hairline. We're going to remove those lines. So those hairs will be removed one at a time with FUE device, with follicular urine extraction. And we place them back on the back. If you look at the other sides, so he is having more of a opening here. The gutter is open. We have to fill those areas. And as we see it from the other angle from the back, this is the typical scar of a strip procedure. So we can go and put hair into the scar and repair those. So if patient want to go with short haircut, they have option. They can do that. On the other side, the scar is even bigger. So to sum it up, a hair transplant repair procedure is a procedure that removes anything that's unnatural from before and add that layer of natural hairlines, single hairlines, add more hair to the areas that patient has lost hair or didn't have hair to start with, and repair the scar procedure.